7. Cognitive rehabilitation. Aphasia can affect a person's cognitive abilities, such as attention, memory, and problem-solving skills. 7. SLPs can help patients improve these skills through cognitive rehabilitation therapy. 8. Augmentative and alternative communication. For patients who have severe communication difficulties, SLPs can provide training in the use of augmentative and alternative communication devices, such as speech-generating devices or communication boards. 9. Counseling. SLPs can provide counseling to aphasia patients and their families to help them cope with the emotional and social impacts of aphasia. 9. SLPs can educate individuals with aphasia and their families about the nature of the condition, the potential cause of recovery, and how to effectively communicate with someone who has aphasia. 9. They can also provide emotional support and counseling to help individuals and their families cope with the challenges of living with aphasia. 10. Education. SLPs can educate patients and their families about aphasia, its causes, and its effects. 10. They can also provide information about community resources and support groups. 11. Develop an individualized treatment plan. Based on the assessment results, the SLP can create a personalized treatment plan that addresses the patient's specific needs and goals. 11. This plan may include a combination of therapy techniques, exercises, and strategies to improve language and communication skills. 12. Use different therapy approaches. SLPs can use a range of therapy techniques to help aphasia patients, such as verbal and written language drills, picture and word associations, conversation practice, and technology-based communication aids. 12. Therapy may also involve working on cognitive skills, such as memory and attention, to support language abilities. 13. Encourage communication strategies. SLPs can also teach patients and their family members communication strategies that can improve communication outside of therapy sessions. 13. For example, using gestures, facial expressions, and visual aids to supplement speech can help aphasia patients get their message across more effectively. 14. Provide counseling and support. Aphasia can be a frustrating and isolating condition, and SLPs can offer emotional support and counseling to help patients cope with the challenges of living with aphasia. 15. Cognitive communication therapy. SLPs can work with patients to improve their ability to process and organize information, and help them develop strategies to compensate for any cognitive impairments. 16. Lifestyle modifications. SLPs can recommend lifestyle modifications such as simplifying the patient's environment, using visual aids, and reducing background noise to make communication easier. 17. Support groups. SLPs can refer patients to support groups or other community resources to help them cope with the emotional and social impact of aphasia. 18. Language therapy. SLPs can provide language therapy to help improve the patient's ability to understand and use language. 18. This can involve exercises to improve word retrieval, sentence structure, and understanding of spoken language. 19. Speech therapy. SLPs can provide speech therapy to help improve the patient's ability to produce speech sounds correctly. 19. This can involve exercises to improve articulation, phonation, and overall speech clarity. 20. Collaborating with other healthcare professionals. SLPs can work collaboratively with other healthcare professionals, such as neurologists, psychologists, and occupational therapists, to provide comprehensive care for aphasia patients. 20. Overall, SLPs play a critical role in helping aphasia patients to improve their communication skills and regain their ability to interact with